Our Ask the Expert series is all about you and all about your questions. So please start to get them ready. Again, our topic today is taking care of diabetes and heart health when your routine is interrupted. Today's event will be hosted in English as well as Spanish. If you're joining by phone and want to participate in the Spanish version, please press *0 now. That's *0 on your keypad. If you're joining us by phone and would like to ask a question, please press *3. That's *3 on your keypad, and an operator will collect your question, place you in a queue, and you'll have the opportunity to ask it live during today's event. If you're participating online, which I know many folks are, please get your questions ready and post them in the streaming player. Remember to hit the submit question button. Your questions will come to me and I will be able to ask them live during today's program. Stay with us throughout the hour. We will answer your questions. We'll get to as many of them as we can. We'll provide you information, resources, and education and useful tips to help you on your journey with diabetes. In addition, please stay tuned at the very end of the event. There'll be a brief 6-question survey. I promise it won't take more than 4 or 5 minutes. Your feedback is essential for us to plan future programs, and we really appreciate any feedback that you give us. Joining our program today is a great step towards taking care of your health. And because of the link between diabetes and heart health, the American Diabetes Association, in conjunction with the American Heart Association, has launched No Diabetes by Heart with support from founding sponsor Novo Nordisk. The No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce your risk of cardiovascular disease. When you live with diabetes, it may increase your risk of heart disease, stroke, and kidney disease. So please make sure when you speak with your doctor or your healthcare provider, you talk about heart disease and how to work towards prevention. Please visit nodiabetesbyheart.org for more information and resources. And now I am thrilled and delighted to introduce today's guest speaker, Dr. Jason Baker. Dr. Baker is an assistant professor of clinical medicine and an attending endocrinologist at New York Presbyterian Weill Cornell Medical Center in New York. Dr. Baker, who also lives with type 1 diabetes himself, is the co-founder and board chair of the nonprofit organization Diabetes Empowerment International, formerly known as Marjorie's Fund. It's a diabetes global initiative dedicated to education, healthcare access, and economic empowerment for people living with diabetes in resource-poor settings. Dr. Baker has various publications in the field of diabetes, and I am so pleased to welcome Dr. Jason Baker to today's program.
Susan, it's great to be part of this, and it's, as always, wonderful to see you and to do anything when it comes to diabetes education. So very excited to be here today.
We appreciate it, and I know how busy you are, so thank you again for joining us today. We appreciate it. Dr. Baker, our Ask the Expert events focus on so many aspects of diabetes self-management and diabetes self-care. But what does a person who's living with diabetes do when life becomes so unpredictable? For example, so many people across the country, across the world have experienced power outages due to storms. And right now, everything we're seeing with the wildfires in California and experiencing the loss of everything we've come to know, not being able to have refrigeration, not having any supplies, possibly even losing our diabetes supplies. What do you do? How do you stay on track with managing your diabetes under such challenging circumstances?
You know, it's a really great and unfortunately, as you mentioned, timely question. And I just want to give a shout out to the ADA for, even just as of today, putting out a notice as to who to call for those who are affected living with diabetes that are suffering from the wildfires in California. Bravo to the ADA for organizing that, and to many of the other organizations that are working to help people, not just on insulin, but other supplies, make sure that they're not interrupted in a way that will affect patients' health. So, you know, I have to say that we are dealing with these things around the world. They might be due to war. They might be due, as you mentioned, Susan, to power outages, any number of storms, and now fires. I think one of the best things to do is to be as prepared as you can before those things strike. So have an emergency plan, have extra supplies. If you're on insulin, make sure you have a backup of supplies, for example. I mentioned to my patients, they oftentimes ask, well, what can I do to be prepared? And I think it's always good to have at least, if you can, 2 months of supplies, both glucose monitoring supplies, insulin pump supplies, insulin itself. Um, Making sure you have a backup so there's no scramble happening if there is an interruption in your ability to get those supplies. And again, in advance, having that as much as you can. Aside from planning in advance, sometimes life happens and we just can't always foresee things, and we might find ourselves unawares. So, making sure that we work to be in touch with our network of supporters. We're never alone with diabetes. It might feel very alone at times, but I think that there are many organizations that work to help to bridge the divide and have us help each other, if you will, have people living with diabetes help others in terms of making sure their supplies are not interrupted. Organizations that are not doing that, local diabetes support organizations, know those organizations and know how to search those organizations online. And again, this is an ADA event, but there's a lot of information, for example, on the ADA patient oriented website with local groups in your area that you might be able to plug into for advice as to where to get your supplies and get help in getting them. The other thing I want to mention is try to stay calm in the setting of an emergency.
Mhm.
When things go really awry with diabetes, many times it happens when we lose the sense of, for lack of better terms, control of our own agency. When that panic button sets in, that's when we might make the decisions about perhaps insulin administration, or we might not be paying attention to low blood sugar risk in the way that we can. So, anytime that we have a disruption in our routine, and emergency situations being one of them, our risk for more severe low sugars and more severe high sugars can happen, and their repercussions on the physical side, on the health side. So, doing your best to stay calm and realizing that there are more resources than we think and that we can see in the moment, and making sure that you're as aware of your blood sugars in those times of extra strife, and realizing your risk of those sugars going awry is higher in those times of strife. So, take a breath, try to stay calm, be prepared as much as you can, as we talked about earlier. But if you stay calm and you are plugged into your communities, and you are, if you can, prepare in advance for having those supplies, you can much better and more successfully weather these storms of literal storms and fires and disruptions of supply. Um, Kind of a long-winded way, Susan, of answering that question. But again, I think it's unfortunately a very timely thing. And we're not alone with this, no matter how much you might feel alone in that setting of crisis.
I think that that was a perfect response, Dr. Baker, and we appreciate bringing together what is actually happening, the physical aspects, and of course, the emotional and stressful aspects. Your diabetes is not going away during a wildfire or a hurricane or a power outage. So, thank you so much
Right.
for addressing that. And as questions are coming in, I know that those are going to be some of the topics that we will address during today's discussion. And again, our topic is taking care of diabetes and heart health when your routine is interrupted. So if you have any questions on this topic and you're calling in by phone, please remember to press *3. That's *3 on your keypad, and we will get to your question live. And if you're participating online, type your name and question into the field below the streaming player. And remember to hit the submit question button, because we are so fortunate to have Dr. Baker with us today to respond to your questions. So very thankful for that. So let's go to one of our questions that's coming in live. And this one comes from, oh, this is an interesting question. This comes from Eva, who is calling from Florida. Eva, please go ahead with your question for Dr. Baker.
Is there any product on the market that is as good as the sticking of the finger with the sensor there? The Dexcom or the Freestyle, those are a percentage, and I wanted to know if there is a product that is as true as the blood type.
So I appreciate the question, and correct me if I'm wrong. I think that your question is thinking about the most precise ways of monitoring your blood sugars, and it sounds like you are aware of the glucose sensors that are there, as well as the, of course, ability to do finger sticks. Um, am I getting your question correctly?
Yes.
So maybe we can just give a little bit of background just on glucose monitoring in general. And I want to put a plug in that I think it's a very important piece of the diabetes puzzle for no matter what kind of type of diabetes that you might have, be it type 2 or type 1 or anywhere in between. So, glucose sensors that you alluded to before, of which there are a few brands available in the United States, and many of which are often covered by your insurance. So, I would encourage you, if you have not yet had the ability to try a glucose sensor, talk to your healthcare provider about whether or not that might be appropriate and see if could be covered by your insurance. They're very helpful tools that check a form of your blood glucose every few minutes with wearing an external device that then sends the information to either your phone or to a receiver that then plots out the graph of your blood sugars over multiple time points over the day. So it gives you great insight in terms of the effects of diet, stress, medicines on your blood glucose levels. Now, again, there are multiple types of these. There's even a type that is implanted underneath the surface of the skin that then can transmit the information to those handheld devices or your phone. So there's a lot of different types of these available. There is a cost associated, but in general, those devices are going to be covered by insurance if somebody is on insulin or if somebody has a history of severe low blood sugars. But there's many times the ability to get these covered, and I would encourage you to talk to your providers about whether or not that's a possibility for you. There are also out of pocket options for these things in which people can buy them themselves, and various brands that are now available for purchasing without a prescription. And not to espouse one brand, but for example, Dexcom Stello is one which is out of pocket now available at the pharmacy without a prescription. That said, there's still also blood glucose monitoring available, which is still a necessary part of diabetes management, as well as many times making sure that these technologies like diabetes sensors are accurate. And glucose testing is the traditional method where you prick your finger and use a test strip in a machine to gauge your blood sugar at that moment. Again, doesn't provide as much information as does a glucose sensor because it's just the sugar at that particular time. You don't know what your sugar was 30 minutes before, nor what it will be 30 minutes hence. And so again, very valuable information is provided by glucose finger pricking. But if you have the ability to do a glucose sensor, it can really provide great insight as to what's happening with your sugars. And you can cater a lot of things, including catering your diet, being able to change things about your diet or change your medications when you see what your uh, continuous glucose levels have been over the course of the day. Again, very valuable information that is kind of a much more common practice now in terms of diabetes management in areas such as the United States. Unfortunately, Eva, there's a lot of parts of the world, many of which I work at and a lot of my colleagues work at, where they don't have access to these types of things, and even populations in the United States, which for whom the price of these things is much too high. But they are very valuable tools, and I would encourage you, if you haven't had the opportunity to talk to your provider about doing them, if that could be of an option for you to be able to get a prescription for or to purchase.
That's a great response, and I'm sure that's very helpful. We're getting similar questions from different people, so that was very helpful for many of the people calling in. We have another question coming in from Jonah, who's calling from Berkeley. Jonah, please go ahead with your question.
Yes, I had a question about whether Dr. Baker could answer how, since I can't do these things, how do people with disabilities adjust to not fingerprinting? I can't do all the things, or how do you monitor your heart health and all that stuff when I really can't do things myself, basically?
Yeah, it's a really good question and a big, I think, barrier when you have a disability, of any type. Um, and so, for example, I think it would really, of course, depend upon the disability, but let's just take, for example, technologies. There are a lot of voice activated systems that use things like Siri or other aspects, which you can, if you can't see, for example, the number that might show up on your glucometer or your phone or your glucose sensing receiver, if we're just talking about sugar numbers for a second, you can have voice activated systems. Many of these are available to be interfaced with this technology where you can just call out and it will tell you what your sugar is in the moment. I would say that if you do have a disability that makes it harder for you to have tactile ability to do a finger stick, which is much more involved in terms of steps, if you will, to check a blood sugar, for example, that might be an indication for using a glucose sensor, because you don't have to do anything other than wear the device. And ultimately, changing the device could have another person perhaps change the device for somebody who's disabled, or they might be able to do them themselves, because most of them in the newer generations of this technology are much easier to use than before. Another thing, just in terms of heart health, that comes to mind is, there are a lot of abilities to follow different parameters of heart health using smartwatches, for example, and things that might follow your pulse rate and your sleep cycle and be able to give you some reports that would give you greater insight if you weren't able to do any sort of self-monitoring of that at home. And many of these reports can be transmitted to healthcare providers. And the last thing that comes to my mind, in the setting of your mentioning of disabilities and how, is that that's one of the beauties of telemedicine, because I think a big barrier to healthcare, to diabetes healthcare certainly, and also heart health, is that because of this technology, much of this can be done remotely. So having the ability to do televisits and being plugged into providers who are amenable and able to do televisits and review those reports with you would make it a lot easier to access those things, especially if transportation to in-person visits is more difficult.
Thank you so much for that. And we have a number of questions coming in live and online, but one of the ones online that just came through from William is that they've heard of this, but they're not sure exactly what it is. What is the Diabetes Disaster Relief Coalition, which we're seeing a lot more come up on social media since the wildfires in California? Can you talk a little bit about that?
Sure. I mean, I think that there are a lot of organizations who are realizing that and reacting to situations, in emergency situations, to ensure that communities come together to help to make sure supplies are distributed adequately, that people don't feel isolated when they're going through these things, with psychological support, as well as making sure that patients are reached, and that if healthcare providers are disrupted in their offices, that there is access to
Yeah.
healthcare, perhaps in other areas for these patients who may not be able to be plugged into their usual healthcare system because it's been disrupted by emergencies. So this coalition is one of many that kind of brings together like-minded individuals in an organized fashion so that people are able to know who to contact and who might be able to then plug them into within their own area a region of support. So, for example, if they were unable to get their diabetes supplies because pharmacies burned down, or they don't have the access to their car, or they can't get access to their doctor, they would be able to be better pointed in the direction of where they might be able to get the right healthcare follow up to get the right type of prescriptions to have those supplies available. Some of those supplies in settings of emergency are also donated. And so this coalition also helps to organize different organizations that come together to donate diabetes supplies, for example, testing supplies, in some settings, insulin, to get them in the hands of people who need it, in the appropriate hands, so that people don't have that they don't have their treatment therefore interrupted. So again, this is coming to light now in a much greater way. Again, as I mentioned earlier on the call, the ADA is really, I think, responding in a very quick and great way to help people to know one of the ways that people and how to reach out to access those uh, support structures within their own communities that have been otherwise disrupted by these disasters.
You even brought up in the disaster of what we're seeing now, and also in war, the hospitals and medical supplies and physicians and other providers might not be available. So, knowing what to do with your supplies and preparedness, thank you so much for addressing that. And we'll get into that even more during today's conversation because it's so important. Let's take another, I should say, live call now. And this one comes from Dora. Dora is calling in now too. Dora, please go ahead with your question.
Well, my question was, how much do you think? Do you think like 120 or 130 be high? I'm a type 2. And also, is 15 to 18 hours fasting, is that bad?
So, Dora, I think that that's a really great question, and I have to say that when we think about, for example, blood sugar goals, because your question is more about for you, for example, is a blood sugar of 120 milligrams per deciliter to 130 on an average level okay and acceptable, and what is too long for you as an individual for not eating anything, and is that healthy? I have to say that it really depends upon the person. So for some people, that level of 120 and 130 may be perfectly fine because they may have other healthcare issues, and they may have a greater risk of low blood sugars where it's determined that that's an appropriate target of blood glucose for them. In general, though, that would be a slightly elevated number in most of the people out there, above a normal value, which is closer to 100 milligrams per deciliter. But 100 is not always appropriate for everybody because, as I mentioned, sometimes we allow sugar targets to be higher based upon what other issues are going on or risks are within an individual. So I would encourage you to ask your healthcare provider what your best goal is, and if that is an acceptable number for you or not. And if it's could be better and safely could be better, I'd encourage you to try to get it a little bit better than that, but you have to get it cleared by your healthcare provider. Fasting for that period of time, as you mentioned, can be a helpful tool for a lot of people for losing weight, but it can also be a dangerous thing if you're on certain medications that can promote low blood sugar. So again, it has to be individualized, and it depends upon what medications you're on and what your targets are for fasting. I usually tell my patients that you don't want to try to fix anything, and let's just take weight, for example. you don't want to try to fix anything overnight. Health is really a marathon, and you should really work towards sustainable changes. So having a fast like that may not be sustainable in the long run, and it may, in some people, lead to greater risks of having their weight fluctuate back up and down, or, as I mentioned, have issues with low blood sugars if they're not careful. They also may not have enough energy in their bodies to get adequate exercise. We need calories in order to be able to burn and build muscle and work out and exercise. And so that is a really important component of diabetes and heart health management. Again, everybody's different in terms of what regimen is right and safe. But fasting in and of itself, a prolonged fast, personally, I wouldn't recommend in everybody, but I do think that it can be personalized in a way so as to smooth out blood sugars and help to promote some weight loss in people. But I would encourage you to not try to look for a quick fix if this is indeed something you're looking for weight loss, but look at more sustainable changes in terms of activity, overall calorie intake, rather than looking to have something like fasting solve that alone.
So, again, a fantastic response to Dora's question. And I want to build on that. As a physician, as an endocrinologist who also lives with type 1 diabetes, do you have any suggestions for all of our attendees, listeners today, and those who are sharing information with their loved ones, their family, their friends? How do you approach your healthcare provider, your physician, your nurse practitioner, whomever you're seeing as a provider, with these questions? How do you come prepared to an appointment when you want to address these very important questions and you want that on the agenda for the very brief visit, whether it be in person or through a telehealth visit? What do you do?
Susan, I think that that's a really great question. And I think part of what leads to a successful visit is for the person to come in organized with what their goals are,
Mhm.
with what their questions are for that visit. And if it's a short visit, realizing that not everything can be covered in one visit, or certainly not everything can be covered adequately. But you have to think about what your questions are, and you also have to stand your ground and realize that your voice is just as important in the conversation as is the healthcare providers. A lot of us are pretty opinionated out there and think that we might have all the answers, but we have to listen to you to be able to guide us on what is best in terms of how to personalize the approach to diabetes. And I take that also for myself. People ask me all the time, Susan, how do you manage your diabetes? What do you do? And I'm very open about it, and I'll tell people, but I say this may not work for you. You have to kind of realize that my body's different than you, my lifestyle is different than yours, and this works for me and gives me good quality of life and not doesn't lead to diabetes distress, which is a very
Yes.
big part of why people might not do very well with managing their diabetes. So, in terms of how to make a healthcare provider visit successful, come with an open mind, that admittedly the person you're seeing might be a little stressed that day. So, try to be a little patient, but also be firm to have an agenda that you are going to make sure is covered for that visit. And that you realize that when somebody suggests a medication, there's no dictum about it. There's a lot of different ways of treating diabetes, and that your voice is important. So if you're not comfortable with something that's discussed, bring it up. And if you feel you leave that visit and you're like, what just happened? And you have a hard time reaching that provider, schedule another visit. I also suggest to people that they have more than one visit scheduled because, it's hard to get appointments with specialists, right? I mean, it's really a big problem. And so months can go by before people can be seen and feel like they can have their questions adequately answered. So also be organized in appointments and think about even having a series of appointments or making your next appointment on the way out of having seen that provider so you're sure you have that follow-up on the books.
And I think your physician really appreciates that because they want to do the best for your care and that working together is everything and so helpful. So thank you so much for that advice. It's so important. We have another great question coming in from Brian. Brian is calling us from Virginia. Brian, please go ahead with your call.
Yes. So my question is, is there a reason why, as my diabetes progresses, why they stop at 2,000 milligrams per day of metformin? I mean, I don't want to go into insulin, so I'm just wondering. But my family doctor says that's the limit on it, and so I'm curious if for some people they can go beyond that if it continues to be beneficial in higher dosages than 2,000 milligrams per day.
Well, it's a really good question. I'll tell you, Brad, I feel that for most people, 2,000 milligrams is the maximum, usually effective and tolerated dose of metformin. Beyond that, oftentimes people start to have more of a potential for side effects, gastrointestinal being one of the more common, paired with that they don't usually get much more benefit in terms of glucose lowering or weight from going to a higher dose. That said, there are patients who go up to a total of 2,500 milligrams, and some people do get a little bit of added benefit from that extra 500 milligram dose. But again, this is where I say diabetes is individualized and there's not a one dose fits all. Beyond 2,500 milligrams is not usually recommended because then the side effect risk can go up. And there's a conversation that needs to be had with providers, certainly. But if you are somebody for whom you needed just a little bit more benefit on glucose, you might benefit perhaps from a higher metformin dose. But if you are really far from your goals, increasing metformin further is probably not going to solve this particular issue. And it might be a situation where you need to have another medication added or putting a plug in for glucose monitoring. Maybe if you were able to know the impact of diet on your blood sugars a little bit more, perhaps a glucose sensor could help even more with getting your sugars down closer to goal and avoid the need for more medications. But again, most people stop at 2,000 milligrams, but a small number do get added benefit from an extra 500.
That's really great point, Dr. Baker, that continuous glucose monitoring can really help us in the self-management of diabetes to see what's going on. Are you getting adequate sleep? Is it your nutrition, your physical activity? Is there stress? And seeing how different foods and different physical activity may be affecting your blood glucose levels. Before even trying additional medications, you may be able to change a lot in your lifestyle.
Exactly. I think I can tell you, Susan, that so many people who end up knowing their number, they come off of medications. I've had people, graduate from all of their medications and they just never even realize the impact of certain elements of their lifestyle. As you mentioned, diet, sleep, stress, exercise. And they're really empowered by knowing their number to enact change so as to not have to rely on medications. And for all the people on this call, I'm not trying to say that you do everything right, you'll come off of medications. Some people can't. But there are a lot of people who get put on meds that if they change their behaviors and their diet and their activity and their weight, they can graduate from some meds and sometimes come off of them. So I like to, when I talk to my patients, to always, many times people say, is this a forever? Do I have to be on this forever? And I say, I don't know. There is a possibility that it will be temporary. Our goal is not for it to be forever when it comes to a medication. So I think it's important for us to have hope and to do everything we can do from a lifestyle perspective so as to minimize our needs for meds. But sometimes we need medications. Certainly, type 1 diabetes is another story. You need insulin. Type 2 diabetes, frequently you do need some medications. But regardless of the type of diabetes you have, as Susan, you were saying, knowing your number if you can with something like a glucose sensor and also optimizing lifestyle can help you to minimize the need for medications, insulin included.
That's right. And taking that point in Brian's question, Paul just wrote in a great thing to address online. Paul writes, please address the caller's concern about using insulin, because what Brian just asked is, wow, I don't want to start insulin. And
Yeah.
Paul says, please address the point of being fearful about insulin. And of course, if you could explain a person with type 1 diabetes, type 2 diabetes, Paul's point is very well taken about the fear.
It's a great question. So again, forgive me if this is basic for many of you on the call, but just as a reminder, you have lots of different flavors of diabetes. And traditionally, we think of a type 1 diabetes as a situation where your body doesn't produce insulin in an adequate amount that's such that you have to take insulin. Insulin is a necessary hormone, a necessary thing for every living human to survive and thrive. You need insulin. The body normally makes it. Type 1 diabetes, it doesn't make it in enough or at all, and you have to take insulin as a medication. Sometimes that's the case in type 2 diabetes when people are unable to be managed adequately with either pills or other non-insulin diabetes, type 2 diabetes injectable medications. So, in many times over the course of time, a person with type 2 diabetes as well is less able to make insulin, so sometimes they have to take insulin. Now, I will say that the fear of insulin is real. Insulin, as I said, is essential for everybody to have in their bodies, whether they have diabetes or whether they don't have diabetes. Insulin is necessary. Insulin is our friend. But insulin is also probably the most dangerous medication that we can prescribe. Low blood sugars, unfortunately, claim a lot of lives around the world. There are a lot of issues that can happen with insulin that whereby it can be quite dangerous. If you overuse insulin as well, a person can gain weight. They can make their insulin resistance, and that's the situation as in type 2 diabetes. They make insulin most frequently, but it doesn't work as well because they're resistant to the effect of insulin. And many times that comes along with obesity being or overweight. So the more insulin a person takes, many times the person can end up gaining more weight, and it kind of snowballs the problem of insulin resistance. They get heavier, more resistant, require more insulin. So insulin, if used correctly, is a
Mhm.
beautiful adjunct for managing diabetes. But Brian, if it comes to looking at type 2 diabetes, usually we like to not start insulin as the next thing. Most people don't need insulin with type 2 diabetes because there's a lot of ways of managing it. But if you do, and if you are unable to manage your blood sugars without it, there is a healthy amount of fear that would go into starting insulin, but you can't let that fear incapacitate you, because if you need insulin and your sugars are high with and are going to be high without it, if used correctly, insulin is life-saving, life prolonging, and helps quality of life go up and prevent complications. There was also, I think, a lot of legacy about insulin use as to being associated with diabetes complications. And Susan, I think you and I had talked about this at some point in the past, but unfortunately, there's a lot of issues when blood sugars are high, whereby people can have a memory that a loved one, for example, was on insulin and then had to get an amputation of their foot, or they had a health problem when they were on insulin. There's the timing many times of the need for insulin when people are
Yes.
advanced in their diabetes, whereby in some um, societal memory, if you will, insulin can have more of a negative connotation, and there can be a
Yeah.
fear about insulin that it's going to cause those problems. What I'm trying to say is that it doesn't cause those problems, but many times it can be more commonly seen in people with those problems because it started either too late or that wasn't used in the right way, and those complications unfortunately developed. But if used correctly, insulin is life-saving, but there's a lot of instruction, and again, goes back to the glucose monitoring. If you had to start insulin, the key to doing it safely is knowing your glucose number. So if your healthcare provider is suggesting adding insulin, ask for a glucose sensor to help to guide you on making sure that dose is safe and correct.
I would say that that's essential, and that's again a discussion to have. Your if you do have a fear of it, and it's something that's being brought up by your provider, discuss it. There, it may
Absolutely.
be, yep, it's the right thing to do, but it's a discussion, and it's a collaborative discussion with you as the person who's going to take the medication as well as the provider. Very good point. We have another call coming in from Joyce. Joyce, please go ahead with your question.
Hi.
Hi.
I've run into circumstances where I have an appointment, and it could be with anybody, not necessarily a doctor. It could be a banker. It could be with a government agency. And what's been happening is I go into these meetings, and I think I'm only going to be there an hour, and I end up being there 2.5 hours. So it's sort of like, how do you handle those types of situations when your schedule is suddenly interrupted? I mean, even though I've planned on being out of the person's office at a certain time and being able to eat and take my insulin, but then I discover that, oh, I'm here longer than I thought, and I'm just not sure how to handle that.
An unpredictable situation in your schedule. Dr.
Yes.
Baker?
Yeah, this is a great and actually pretty timely as of my clinical session this morning, actually. um,
Yes.
I have to say that many times, and let's just take it from the healthcare provider side. I know you mentioned banking and any aspect in life, right? When when you're visiting your provider, expect unfortunately expect and anticipate that they're probably going to be running a little bit behind, and some providers more than others, because you can't always predict how long a person's visit is going to take, and it might be a much more complicated visit with a lot more issues to attend to, that then makes the provider be much further behind in their schedule, and unfortunately makes a lot of people have to wait. I would come prepared and expecting in that situation or otherwise as a patient that you will be there longer than you anticipate. And if they've asked you to fast, bring sugar sources with you and try your best to know your glucose number so you don't dip low. And plan ahead with your provider if perhaps there's a way, if you're fasting in anticipation of blood tests, perhaps you can get your blood tested before the visit. Not every provider would like this, but in that setting, you can come to an appointment, not having to interrupt your medications because of fasting for anticipated blood tests, for example. And so have that conversation about the timing of the bloods. When it comes to the timing of your medications, you should, again, make sure that you understand and talk through with your provider which ones should be in the morning, if there are any in the afternoon, and if there are any in the evening. And if you're unsure as to how long, and hopefully an appointment wouldn't last so long as to go from the morning to the evening, but be organized and bring what it is you need to self manage your diabetes, assuming that the appointment is 2 times or 3 times as long as that you expect it to be. I hate to say it, but it's going to happen at some point with any of the providers. And so have sugar sources and have a plan. And so you're not stressed, because when you're going into the appointment also stressed, you might not be able to bring up the subjects that you need to bring up to have a successful appointment and come out of that visit feeling empowered and full of more knowledge than you went into that visit with.
And Dr. Baker speaks from real life experience today, because up until the moment we started today's event, he was seeing patients, caring for his own diabetes, and doing everything else he has to do. So
And,
you have no idea how much we appreciate you being here today. We really, really do. Right? That was your crazy day today as
oh
it's
no,
going on.
yeah, I think I gave Susan a little start. But but it's the reality of medicine, and it's the
Yeah.
reality of many things in life. And this is part of, per your question, we need to be prepared for the unknown. So
Yep.
rarely is any situation going to be fully um, to our plan. And I always also want to throw out a little pearl that I use personally and that I remind my patients of. A lot of the time we know, for example, if you're thinking about blood sugars, why the number may have gone up or down, or where that low might have come from. But a good percentage of the time, and I would argue at least 30, maybe even 40% of the time, we don't know. Sometimes it just happens. And sometimes it's a problem with the technology we're using. Sometimes there's just a issue with the medication, but sometimes we can't explain it. So don't let those unknowns beat you down and lead to more diabetes distress. Realize that, be prepared for some aspect of chaos living with diabetes. And if you're prepared for it and you expect it, then you can weather any of these unknowns in a much more successful way.
Yes, you're giving yourself a bigger chance for success in dealing with daily problems and daily problems with diabetes. So we have to remember to speak with our doctors or our healthcare providers about your health goals. And as Dr. Baker said throughout today's program, even come in with a written list of an agenda or the questions that you want to ask, or share them beforehand so the provider knows exactly what you want to address. And if you have any questions about your diabetes, about your heart health, or an interest in diabetes technology, always speak to your physician or your healthcare provider. Speak with them about your lifestyle and all the options that are going on so that you can reduce your risk of heart disease and of high blood pressure. Discuss your blood glucose levels. Our discussion today about CGM, continuous glucose monitoring, knowing your numbers and your lipid targets are so important to discuss with your provider. Please also remember, at the end of today's event, in a few minutes, we're going to be conducting a very brief, short survey, and we'd really appreciate you staying on to discuss that. Dr. Baker, what are some of the additional key points that you'd like to share with our listeners? There was so much great information shared today. I would love to know if there are any other key take-home points you'd like to share.
Gosh, I feel that be patient with yourself and realize when you're managing yourself, let's just looking at diabetes, for example, with glucose, and if you don't have the outcome you're looking for, if you come in and you say, gosh, my A1C is higher and you're upset by that, or your sugar's higher in response to what you were eating, don't take the energy to beat yourself up, to berate yourself. Don't go in apologizing to your provider. Instead, say, okay, this is the information that I'm dealing with right now. How am I going to change this in the future? Use your energy, instead of beating yourself up, to figure out how to fix it and move forward so as to learn from those mistakes to not repeat them. We only have so much energy to go around. And when you beat yourself up and when there's any shame around living with diabetes, in any chronic medical issue for that matter, including anything cardiovascular, your energy gets depleted and it doesn't go towards your own self-care. So make sure that you're thinking about your psychological health as you go through managing your diabetes or any chronic condition. Because if your psychological health is not there, and communicate if you're comfortable with your provider about that. Because if something is going on with your life and they're planning to, for example, change your regimen of treatment in a way that adds extra stress, the timing of that change might not be right and might not be as successful as it could be. So have your psychological health front and center when it comes to managing your diabetes, and make sure that your psychological tank is full, and then you'll have a lot more bandwidth to successfully manage any medical issue, diabetes included.
That's such great advice. Thank you so much for that and in all your advice today. So everyone listening today, please remember to speak with your doctor and members of your healthcare team, including your diabetes care and education specialists, about your risk of heart disease, heart failure, stroke, and kidney disease. Remember to get a referral to a diabetes self-management education program. Go to nodiabetesbyheart.org, sign up for our newsletter. Please register for our next events at diabetes.org/experts, or call 1-800-DIABETES. That's 1-800-342-2383, or email askada@diabetes.org to request a digital copy of How to Thrive resource that can help you on your diabetes journey. Thank you for your incredibly great questions today that you all called in with and wrote in with. We had a ton of questions, just not enough time to get to all of them. So I hope that you bring them to our next event. We're so sorry if we couldn't get to all of your questions, but if you want to contact us again at askada@diabetes.org or call 1-800-342-2383. You can ask us additional questions that are related to your diabetes. Please remember that all the Ask the Expert events are available on demand anytime at diabetes.org/experts, at diabetes.org/experts. Thriving with Diabetes takes a team, and we are so happy to support you. A very special thanks to our guest expert today, Dr. Jason Baker. He is incredible. My name is Susan Weiner, and on behalf of the ADA team, we want to thank you for joining us today, and we look forward to connecting with you at our next event, which will be on February 11th. And the title of that event is No Diabetes by Heart. So please join us for that as well. Look at our website at diabetes.org/experts and register today. If you have any questions, please again contact us at askada@diabetes.org. And please remember to put in the subject line, Ask the Experts Q&A, so that we will know that it is about these events. And we appreciate you. So let's start our very quick survey. If everybody would please continue to stay on and participate, it will only take a few minutes. There are 6 brief questions. And the first question is, this event met my expectations today. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. This event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. As Dr. Baker spoke about today, support in managing diabetes is very important, and you should not feel alone, but you might. So please check out diabetes.org, the website, because there are tons of links that can help you on your journey with diabetes so that you don't feel alone and that you can get some support. Question 2. I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. We also discussed a lot about technology today. You can find out a lot more about diabetes and technology on the ADA site. Diabetes Technology Guide is available on diabetes.org. There is a lot of great information there as well. You can learn more about CGMs, blood glucose monitors, etc. on that site. Let's move on to question 3. Question 3. This event improved my knowledge of taking care of diabetes and heart health when your routine is interrupted. This event improved my knowledge of taking care of diabetes and heart health when your routine is interrupted. For yes, please press 1. For no, 2. And if you're unsure, please press 3. This event improved my knowledge of taking care of diabetes and heart health when your routine is interrupted. For yes, press 1. For no, press 2. And if you're unsure, press 3. Did you know that there are approximately 38 million people living with diabetes? If you are looking for more support, again, go to diabetes.org/community for more information. That's www.diabetes.org/community for more information. A couple more questions. Question 4. I intend to use my knowledge that I gained for myself or my loved one's next appointment with a healthcare professional. I intend to use the knowledge I gained for my or my loved one's next appointment with a healthcare professional. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Remember to check out nodiabetesbyheart.org. That's nodiabetesbyheart.org to learn more about how to take simple and practical steps to reduce your risk of heart attack, heart failure, diabetes, and kidney disease. It's a great resource, nodiabetesbyheart.org. Question 5, and there are 6 in total. So question 5. Before this event, I felt confident talking to a healthcare professional about my or my loved ones how to take care of diabetes and heart health when my routine is interrupted. Let me read that again. Question 5. Before this event, I felt confident talking to a healthcare professional about my or my loved ones taking care of diabetes and heart health when my routine is interrupted. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. For yes, press 1. For no, press 2. And if you're unsure, please press 3. There is so much to know about taking care of your health when living with diabetes, and it can be overwhelming. If you want to learn more about strategies and tools for diabetes burnout and mental health, please check out diabetes.org/health wellness mental health. And a simple way to navigate that on the site is just plug in the search mental health, and it will lead you to the resources. And our final question, question 6. After this event, I feel confident talking to a healthcare professional about my or my loved ones taking care of diabetes and heart health when my routine is interrupted. Question 6. After this event, I feel confident talking to a healthcare professional about my or my loved ones taking care of diabetes and heart health when the routine is interrupted. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. We sincerely appreciate your time, and we look forward to connecting with you on our future event. Our next one will be on February 11th. That's our next Ask the Expert event. Please visit diabetes.org/experts to learn more. Thank you so much. We appreciate you and your time.